An ACO is about collaboration, and it's bringing together insurers, physicians, and hospitals.
It is an organized network of physicians and other delivery components, typically hospitals as well, interested in being financially rewarded for delivering the very best care that they can to a defined population.
Everybody is working together as a single team to help you become as healthy or avoid the progression of disease as much as possible.
In the past, everybody had information in different silos, and now we're trying to bring all of that information together. So we're mining that data, and then we're making that data available to people that can take action on it with you.
That means that information must be stored electronically, available electronically, and available at all sites of the delivery system, regardless of where the patient happens to be.
Our strategy is to take the complexity away from the delivery system, away from the hospital, allow them to focus on what they do best, which is providing care, and give the responsibilities of making sure the technology is available to Aetna, which has a strong and long track record of being able to do these things.
If we can actually measure a level of patient service, measure our clinical outcomes, track our financial performance, and understand the population's health much more effectively than we could 20 years ago, this is the place to go, and it's going to impact American healthcare in a dramatic and very favorable way.
Our technologies enable the physician to get a quick readout that says, for this particular patient, here's all the things that the evidence base, the clinical research says you should have, and here are the things we don't see in your electronic record.
It will engage a whole team of care. It may involve everyone from a health coach to the pharmacist to a case manager to a physician leading other advanced practice individuals in an office setting, maybe even home visits by individuals.
The patient's got to be an active participant in this.
If we don't empower the patients to be able to do a better job of managing their disease, we will be limited in our ability to improve quality and reduce costs.
We have to be able to try to keep people healthy and understand what their health needs are, potentially better than they do. And that means that we're going to need to, in fact, understand what their health challenges are, even if they feel well and have not interacted with the health system.
If you engage with us in an ACO, we're going to make sure to find resources to help manage your conditions or keep you healthy if you're in a healthy state. We can't harness our domestic industries with a burden of healthcare costs that they can't sustain. So we need to lower the trend rate so that they can be more competitive.
You can actually begin to empower patients with information that may allow them to better manage the disease and avoid that ER admission, avoid that hospitalization, improve their satisfaction with their own empowerment, but also reduce the cost of healthcare for the entire community.
We want the long-term trends to reverse and that healthcare costs don't keep going up and up and up and people can't afford it.
Aetna and Banner are very much strategically aligned. They both bring competencies to the equation, and they've designed a reward system to achieve those goals where both win.
One of the things that's attracted us to Aetna in this model is that Aetna's built capabilities to turn piles of data into actionable clinical information that is helpful to patients and helpful to the care providers.
Aetna has a strategic vision for the future, which is consistent with a collaboration between provider organizations and traditional insurance organizations. Their future is based on that relationship working.
This is my chance to leave this industry better than I found it. And that's what motivates me every day. I really believe that. I think that we can find a better way of running this U.S. healthcare system, and now we actually have the opportunity to do that.